Good morning and welcome to part 3 of the alcohol addiction video series. So today we are going to start with 3 quickfire questions. The first one is, does the person receiving the hypnotherapy have to have admitted that they have a problem and want to stop drinking? The short answer is yes. The person does need to be ready and willing to make a change, because whilst hypnotherapy is extremely powerful and highly effective, it's not a magic wand and we can't use it to change somebody's will. So they have to be in a place where they are ready to make a change. But as soon as they are, we really can make big changes with them really quickly. Question 2, does the person receiving hypnotherapy have to believe in hypnotherapy for it to work? No, not really. As long as you are open to the idea that it could work, there is absolutely no reason why it won't. The only time that it wouldn't work is if you were actively resisting. And to be perfectly honest, if you have paid to join one of my programs, then chances are you are wanting to receive the desired outcome and you're not going to be fighting it. Because let's face it, if you've paid for a program and we've gone through all of the initial consultation and we've begun doing the therapy, then you're going to want to stop. You're already in that place of, I want to make a change. I want to transform my life. So no, you don't actually have to believe 100% that hypnotherapy is the answer. You don't have to believe that it will 100% transform your life. You just need to be open to the fact that it could. Make sense? Question 3. Do I have to come to your therapy centre in Kirkcaldy to receive treatment? What if I'm not local or not in Fife? Okay, this is a nice easy one. No, you don't have to come to the Amy Gibbs Therapy Centre in Kirkcaldy. Whilst if you are local, that is an ideal option for you. But if you are not, we can do hypnotherapy sessions via Skype or any other video calling facility for that matter. I have clients up and down the country. In fact, I am soon to take on a client in another country. So it's absolutely possible. We need to do a little bit of arranging if you are outside of the UK because there are time differences. But no, absolutely. You could be anywhere in Scotland, England, Ireland, Wales, or anywhere else for that matter. And hypnotherapy is just as effective done via Skype as it is face-to-face. So your location is of no relevance whatsoever. I can still help. So now that we have those answered, today we are going to start talking about the Awesome Without Alcohol program. So this is the comprehensive program that I've put together to help anybody that is battling with alcohol misuse or alcohol addiction. So module 1 is looking at helping you to stop drinking. So that's alcohol cessation. Now, in many clients, it literally just takes one session to break that habit. Although in some it can take more, and that's absolutely normal and natural and not a problem. But you will notice differences from the very beginning. So we start by doing sessions aimed at changing the way that you think and feel about alcohol. So basically we remove that desire. There's no need for you to drink because you don't want to, you don't need to, so you don't. Nice and easy. Or I make it sound nice and easy, don't I? You may think right now, it's not that easy, Amy. It's just not that easy. There's so many other things to consider. It's fine. We'll get to those. But in the very first session, we help you to stop drinking. What we then do is once you have stopped, if you suffer with any withdrawal symptoms, which is quite possible, especially if you've been drinking quite a lot for quite a while, your body is going to experience some level of physical withdrawal. So you may find that you get the shakes, that you are sweating, that you feel nauseous, that you are in some level of physical discomfort or pain. You may find that you get headaches. You may find that you're not able to sleep properly. There may be some level of anxiety or depression. All of these things, again, are very normal, are very common. So we can use hypnotherapy to arm you with techniques and strategies to help relieve that discomfort, to help to manage those withdrawal symptoms with as little discomfort as possible. So withdrawal isn't something to fear. It is a part of your recovery. If you have been dependent on any substance, be it alcohol or drugs or anything else, your body is going to go through some withdrawal as it flushes out the toxins from your system, but it is absolutely necessary step. The other thing that I would ask you to consider is working alongside your GP or a professional that they recommend. Because whilst hypnotherapy is highly effective and whilst it can make changes very rapidly, I can't be there in person for you should withdrawal be really severe. Now, as I said, the hypnotherapy sessions I can offer will make a big difference to you and they will make withdrawal easier. However, there are certain things that you need to look out for, because if you start experiencing the DTs, which stands for delirium tremens, this is a central nervous system symptom of alcohol withdrawal, and it is seen in chronic alcoholism. So symptoms of the DTs can include uncontrollable trembling, hallucinations, severe anxiety, sweating, and sudden feelings of terror. Now, if you experience any of these, if your symptoms of withdrawal are really severe, if they are not being managed with hypnotherapy, then it is really, really important that you speak to your GP or you go to a local hospital, because if you have gone from just being in withdrawal to experiencing DTs, then you are at a much higher risk of further complications. And so I will always encourage any of my clients who I'm seeing for alcohol addiction to let their GP know, to have somebody on standby. So have a family member that's either with you when you're doing it, that's someone that can stay with you for a few days, somebody that's very nearby, so that if your symptoms become unmanageable at home on your own, that you have somebody that can take you to the local A&E to get treatment. Because the last thing we want is for you to go into severe DTs, because I'm not going to beat around the bush. DTs can be fatal. Okay, so as I say, hypnotherapy is very effective in getting you off the alcohol, and is very effective in dealing with normal level withdrawal symptoms. However, if you are unfortunate enough to start getting the DTs and you can't manage that at home, you need emergency medical attention. So I'm just putting that out there. But basically what we do, as I say, we get you off the alcohol and we help you to manage any of your basic withdrawal symptoms. And for the majority of people, that is all that is needed. But the reason that I put that warning in there is because there is a small chance that you may need medical intervention. And that's got nothing to do with the fact that you're using hypnotherapy to stop. The same thing, you would be at the same level of risk if you decided to go cold turkey at home. So it's nothing to do with the hypnotherapy. It is very much to do with the sudden stopping of alcohol. So module 1 is aimed at that, stopping you drinking, getting you through withdrawal. And then we move on to tackle the underlying reasons. So that's what we're going to be talking about tomorrow in module 2. We will be looking at your reasons for drinking and how we tackle the underlying reasons so that we can try and prevent you from relapsing. So stay tuned and come back tomorrow for module 2 of the Awesome Without Alcohol program. Take care. Bye-bye.